Science Biology. Let's practice some quick and important MCQ on effect of air pollutants on human health. Perfect for your exam and quick revision. Stay tuned and let's level up your preparation in minutes. Question number 1. Which of the following is not a factor on which effect the gaseous pollutants are depend on? Answer is option A. Atmospheric characteristics is not a factor which affect the gaseous. Question number 2. Where do highly soluble gases deposit in the respiratory tract? Answer is option B. Upper respiratory tract. In upper respiratory tract, high soluble gas deposit. They are retained in respiratory tract because there is a high solubility. An example of highly soluble gas is a sulfur dioxide. Sulfur dioxide is a highly soluble gas. Question number 3. Which part of respiratory system do sparingly soluble gaseous pollutants get deposited? Answer is option D. In the lungs. Question number 4. Where is 95% of total sulfur dioxide retained? Answer option B. In upper respiratory tract. Sulfur dioxide is highly soluble in water and gets retained in the upper respiratory tract. About 95% of it get absorbed here. The rest may progress further and may even reach in the lungs. Question number 5. Sulfur dioxide is more harmful than sulfate. Answer is true. Yes, sulfur dioxide is more harmful than sulfate because sulfur dioxide absorbed by upper respiratory tract and it is not much as of the threat as the aerosol counterparts. Sulfates, even sulfuric acid, form in the atmosphere, may reach the lungs where it can have chronic health effect. Question number 6. What is an alternate way sulfur dioxide can enter the lungs? Answer option C. Absorbed by salt. Because sulfur dioxide is the primary mode of entrance into the body as a gas. Its alternative method would be by being absorbed by aerosol of metals and their salt, and sulfuric acid formation occurs in the lungs. Question number 7. At what concentration of exposure to sulfur dioxide does eye irritation occur? Answer 10 ppm. Symptoms of exposure to sulfur dioxide manifest differently depending upon the concentration of exposure. Eye irritation occur at 10 ppm concentration of sulfur dioxide. At 9 ppm, throat irritation, and 20 ppm coughing occurs. Question number 8. What is the chronic effect of exposure to sulfur dioxide? Answer option A. Respiratory infection. A chronic effect of exposure to low concentration of sulfur dioxide is respiratory infection, especially in children. The other given options like eye and throat irritation are the short-term effect. Question number 9. Which of the following statement about carbon monoxide is untrue? Answer is option B. It gets absorbed by the upper respiratory tract. Is the carbon monoxide does not get absorbed by the upper respiratory tract. It is because it is soluble in water and it managed to reach the far as well as alveoli, where it diffuse into the blood. Question number 10. Carbon monoxide is carcinogenic. Answer is false. Carbon monoxide itself does not carcinogenic. However, it may enhance the effect of carcinogenic pollutant. It does so preventing the natural working of normal lung function. Question number 11. What is the primary health effect of nitric oxide? Answer option A. It is not harmful. By itself, nitric oxide has no health effect and is not harmful to human. In the atmosphere, nitric oxide convert into nitrogen dioxide, which have several health effects. This conversion is the reason why high concentration of nitric oxide are concerning. Question number 12. Which of the following is a reductional product of sulfur dioxide in the atmosphere? Answer option C. It does not get reduced. Sulfur dioxide does not get reduced in the atmosphere. On the other hand, it does get oxidized in the atmosphere to produce sulfur trioxide. Further, sulfur trioxide is then converted to sulfuric acid is an aerosol. Question number 30. How far does nitrogen dioxide penetrate the respiratory system? Answer is in the lungs. Nitrogen dioxide penetrates as far as the alveoli of the lungs, which is pretty deep. Nitrogen dioxide is insoluble in water, therefore cannot be trapped by the mechanism in the system. Question 40. What happens to nitrogen dioxide when it reaches the alveoli in the lungs? Answer option B. It converts the nitrous oxide. Once nitrogen dioxide reaches the lungs, it gets converted to nitrous oxide and even in nitric acid. These material are irritates and damage the lung tissue even in low concentration. Question number 50. Respiratory disease is a symptom of exposure to nitrogen dioxide. What concentration and period of exposure does one need to have for it to manifest? Answer is option A. Low concentration and long period of exposure to need have to it manifest. Question number 60. What is an indirect effect of nitrogen dioxide on human health? Answer option C. It produces secondary pollutant. Nitrogen dioxide produces secondary pollutants in the atmosphere, especially in photochemical smoke. These pollutants are oxidants like ozone, which are very harmful to human health. Question number 70. At which concentration do aliphatic hydrocarbons have adverse health effect? Answer 500 ppm. Generally, hydrocarbons do not have adverse health effect on human body at normal atmospheric condition. The concentration of exposure has very high than 500 ppm. The aliphatic hydrocarbon affect human health. Question number 80. Which is the health effect of the aromatic hydrocarbons? Answer option B. Irritation of muscles membrane affect the health. Aromatic hydrocarbons are known to irritate of muscles membrane in the respiratory system. These hydrocarbons are more reactive than aliphatic hydrocarbon because they are unsaturated in nature. Question number 90. Which part of body does ozone affect? Answer option C. The respiratory system. It was previously believed that ozone not irritate eyes at low concentration. This belief since has been disproven. It does, however, have adverse effect on the respiratory system even at low concentration. Question number 20. Which of the following smoke oxidant cause eye irritation? Answer option A. Peroxyl acyl nitrite. is cause eye irritation. Hydrogen peroxide does not produce from smoke, so it is not answer. Ozone does not cause eye irritation, so that is not the answer. Only peroxyl acetyl nitrate cause eye irritation among the given option. So correct answer is option A. Question number 21. Which of the following symptoms are acute effect of exposure to ozone? Answer option C, severe cough. Among the given option, only severe cough is an acute effect of exposure to ozone. When exposure to ozone is about 10 ppm continuously for 2 hours, severe cough may cause.